Community Integrated Development Initiative (CIDI) is an indigenous national non-profit making organization. It was founded in 1996 and her vision is to improve people's livelihoods and create self-sustaining communities through provision of equitable, participatory integrated development intervention.
My name is Advocacy, Senior Nursing Officer, MCH, Maternal Child Health Focal Person for the district. I do really thank CIDI for the support, technical and financial support provided to Wakiso district. CIDI is an organization which I have worked with for some years now, but we really thank you for the support to see that mothers and children have a good life.
CIDI prides in working with communities under the thematic areas of water, sanitation and hygiene, sustainable agriculture, microfinance, health as in reproductive health, maternal and child health, HIV/AIDS prevention, nutrition and malaria prevention, advocacy and lobbying, as well as consultancy services. CIDI has its headquarters along Tanki Road, Muyenga, with field offices in Rakai, Soroti, Amoria, Katakwi and Napak. This is in addition to having interventions in Luweero, Mukono, Lila, Wakiso, Kampala and Masaka. Among its strategic goals is to contribute towards increased community awareness and health literacy on accessibility, disease prevention, and promotion of healthy lifestyles and reproductive health.
CIDI has sensitized the communities on being aware about reproductive health issues, especially with maternal and child health. He has also supported us in Child Healthy Days, where he supports our staffs to go for outreaches in the communities to offer vitamin A and deworming. He has also supported us in our health facilities with the infection control equipment like jig, buckets, washing soap, and others. We do really thank CIDI as a district.
CIDI, with funding from CODATE, has been running for 2 years now a maternal and child health advocacy project with an aim of contributing towards improved maternal and child health as well as their socio-economic well-being in selected districts of Wakiso, Kampala and Mukono. All this has been done to see that there is a reduction in maternal and child mortalities and also to get women attend antenatal during pregnancy.
Also, the other issue, I wanted to encourage these mothers to deliver in safe hands, because in most cases, these mothers deliver in unsafe hands, especially in the villages. Fine, we have traditional birth attendants, but at the moment, they are not so much recognized because we don't make proper follow-up of them. And the ministry doesn't facilitate us to make a follow-up on them. So I would encourage the mothers who are out there in the community or in the villages to see that they deliver in safe hands, which are the hospitals and the health centers.
Maternal and newborn deaths are a major concern in Uganda.
Maternal child health is a very big component, whereby we want to see that no mother is dying because of delivering or because of pregnancy. And this is the Millennium Development Goal number 5. So we really appreciate whatever CIDI has put forward to see that no mother is dying. And even for children, also we are looking at Millennium Development Goal 4, where we want to see the improvement of health in the children.
CIDI executes most of her work through community structures and groups which comprise of farmers groups, advocacy structures, and VHTs. The maternal mortality rates for Uganda is still high at 435 deaths per 100,000 live births. One of the objectives of the Ministry of Health is to improve the quality of care of mothers and newborns in order to achieve a Millennium Development Goals 4 and 5, which aim at reducing child mortality and to improving maternal health, respectively, by 2015.
So we also request the Ministry of Health to continue supporting us with equipment and also to recruit more health workers, especially midwives. At least now we have doctors and our theatres at Health Center 4 have started being operational.
The health of a mother impacts the family and even the entire community. Her ability and access to receive necessary health care largely determines health outcomes for herself and her baby. Like many developing countries, Uganda has high maternal mortality rates, which is often reflective of access to health care services. Even when healthcare services are available, they are often understaffed and low on supplies, which can also have an effect. Traditionally, Ugandan women seek to handle birth on their own, as it is a time when they can use their own power and make their own decisions, which can also be a factor in such a high maternal mortality rate.
VHT ab'omubyalo ffe tusomesa abakyala okuzaaliranga mu malwaliro nga bw'azaala omwana ati n'amugemesa endwadde omulala zinnamutta okugeza nga poliyo paka ku measles. N'olwekyo nnyabo tuzze okumanya oba wali ogenzeeko mu kiliniki.
Nze mu ddwaliro sigendangayo. Maama affe yatuzaala abaana 17 naye nga buli omu amuzaalira wa.
Ekitegeeza naawe togenda mu ddwaliro?
Nze sigendayo.
Bannange nedda nnyabo twagala otandika ogenda okunywa eddagala ate n'abaana bano ng'obazadde babatwalibwa bagemwe baba batanaweza myaka 5. Kakati nnyabo tukulabyeko. Naye nga twagala ogende mu ddwaliro ofune ekipande. Kale nnyabo wamijja mutulabya ng'akomyewo.
CIDI has supported us in so many areas concerning reproductive health. We have sensitized our local leaders at sub-county level and even the district level. They have held stakeholders meetings, they have done community dialogues, and issues have come up concerning health, concerning our health facilities, concerning our health workers, how they behave. These are all good lessons learned for the district. CIDI supported us also in Child Health Days. They supported us for 2 years now. Every Child Health Days is supporting us with the funds to top up on what we have as primary care funds so that health workers can go and reach out to every child and mother with the vitamin A and deworming. Also, CIDI assisted us in infection control measures. We equipped our health facilities in Nangabo and sub-county with the infection control equipment like jig, buckets, washing soap, surgical gloves, and others. We do really thank you so much for all that support. It has also built capacity in our for our health workers in the exclusive medical center. He also trained health unit management committees. At least we were oriented and now they know their roles and responsibilities. CIDI, we really thank you for the work.
Many women report mistreatment from healthcare personnel as an additional reason to avoid seeking professional care during pregnancy and labor.
Also, attitude of health workers is also one of the issues which came up during the community dialogue, that midwives are harsh, midwives are rude, but we try to encourage our midwives not to be rude, not to be harsh with pregnant mothers, because you don't want to lose mothers staying at home to deliver from home and then they die, yet services are there.
A study also found that a majority of Ugandan women lack health literacy and in turn seek care in more traditional or homeopathic ways. Malaria is also a substantial issue. Pregnant women and their newborn babies are particularly susceptible to complications related to malaria, which is endemic in Uganda. This is also an issue that needs to be addressed in order to improve maternal mortality in Uganda. CIDI has taken on the role of building the capacity of VHTs. It has also gone ahead to avail refueler booklets for use to both health workers and VHTs. This has encouraged mothers to deliver at health facilities established within their communities, plus continuous follow-up after delivery. Strategic partnerships have been created at community, district, and national levels through organizing platforms for lobbying and advocacy for improved services to expectant mothers and children, investing in community sensitization, hence an improvement in ANC attendances within the catchment area, improved ability of the community to identify and prioritize their own health concerns, and improved responsiveness of health service providers towards the provision of maternal and child health services. Not forgetting CID's participation in health networks and coalitions like the Civil Society Coalition on Maternal, Newborn and Child Health has seen an improvement in advocacy-related issues at national level, such as increments in budgetary allocations to human resource for health, essential commodities for maternal and child health. According to the survey, every day 16% of mothers die while giving birth in the whole country. These are the registered ones, and there are many who die in rural villages unregistered due to the long distance to the health facilities. So these pregnant women still travel a long distance to access life-saving services. Other challenges that affects the maternal health is the underfunding, as the health centers lack basic facilities such as antisepticals, surgical blades, mama kits, and others, which leads to deaths. Also, the unrelenting reports of human resource challenges within the country's health sector should cause us to pause and consider the health situation in order to make practical and progressive steps. Reports from districts show that the rate of health workers reporting to work after appointment was greatly affected by the lack of staff accommodation. Still, for the health workers who reported to work, their retention will be greatly determined by the availability and state of accommodation, according to the survey. Maternal Health Report 2012, Ministry of Health.